We at South Coast are absolutely delighted to have this partnership with Boston Children's Hospital. Our physicians are excited, our community is excited, and most importantly, children will have access to the very best care.
The collaboration with Boston Children's Hospital brings to our region a level of expertise of one of the top pediatric hospitals in the country. We will have Boston Children's Hospital physicians at St. Luke's Hospital available 24/7 for our families, preventing them from needing to travel to get that level of expert care.
One of the pieces of the program was to dedicate a space to the pediatric patients that come through St. Luke's Hospital. There's a 5-bed pediatric emergency department that is isolated from the main emergency department and a dedicated pediatric waiting room.
It is vital to have a pediatric dedicated area in an emergency department where it's more comfortable for them, it's not as scary.
The ED space is wonderful. We are able to specialize the equipment for them, and it gives them a safe place when they're not feeling well.
We also have an inpatient unit that is dedicated to pediatrics, and it has undergone renovations so that families are more comfortable when they need to be admitted to the hospital.
Looking around, they can see the updated equipment, a nice clean environment. The kids, I think, will be more geared to the playroom and the video games that we have.
One of the things that we worked on very early was establishing a relationship with the community pediatricians. The community pediatricians are the entry point for most of the patients in this area, and through good communication with them, we feel that this will improve the care of children locally.
The collaboration between the local physicians and the hospitalist service has really been a benefit to the patients locally.
It's a great community to live in and raise children. Sometimes we have limited resources though, and pediatric care I think is definitely one of those areas. So having a collaboration with Boston Children's Hospital enables us to always tell families and children in this area that we now have this connection with one of the greatest children's hospitals in the whole world.
It excites me that we've had a learning opportunity for our own staff, many of whom have been pediatric nurses for many years. We're going to be able to expand what we're able to care for and really offer a professional growth opportunity to our staff.
There have been trainings for nurses, ancillary staff, and physicians around best practices, quality improvement measures, guidelines on management of different pediatric illnesses.
Both for physicians and nurses, having a Boston Children's Hospital pediatrician in-house, it raises their comfort level in how they can deliver care. I round every day with the parents and the feedback has been great. They're very satisfied with the care. They've talked about how nice and friendly and informative the staff has been.
Max came in through the ED at St. Luke's. They decided he was going to have to stay a few nights, so he was then transferred up to the new PD unit. I was very glad to hear that the physician here was from Boston Children's. It was nice to get that Boston care closer to home.
While we're located at St. Luke's Hospital, we'll be taking in patients from Toby Hospital and Charlton Hospital.
Emergency department physicians in those regions are able to make a phone call and get expert consultation by a Boston Children's Hospital pediatrician, and that is available 24/7.
So many families have multiple children and childcare issues, transportation issues, and it's very expensive to go up and stay in Boston and back and forth. So I think it's great to have something of this quality nearby so that they feel that they're getting the best care without having to leave the community.
This was a priority for our Board of Trustees and our leadership team because we wanted to be able to provide pediatric care that we could all really get behind and be proud of. And we knew that by partnering with Boston Children's Hospital, we'd be able to achieve that goal.